Are you ready for some booze? We sure are, but not exactly the kind of booze we're going to be discussing in this video. Wood alcohol, or methanol, can be found in homemade alcoholic beverages. During the Prohibition era, bootleggers distilled wood to sell homemade alcohol, or moonshine, as can be seen in this photo. So hop on board, we're going to be taking a trip to learn more about the moonshine men of Kentucky and methanol poisoning. First, notice the trees in the backyard. Yep, we're brewing alcohol in the woods, which should help you remember wood alcohol. This is here to help you remember that methanol is also called wood alcohol. Methanol got the name wood alcohol because it used to be mainly produced by distilling wood, which fits perfectly into the scene on moonshine or homebrewed alcohol. On exam day, just know that methanol is also known as wood alcohol, and it can contaminate normal alcohol or ethanol with improper brewing techniques. Next, notice the wooden barrel and the metal hip flask it's being poured into. This is here to remind you of methyl or metal alcohol, another name for methanol. Just remember our wood alcohol getting poured into metal flasks to remember methyl alcohol. Now that we know all the different names of methanol, let's talk about some of the clinical findings you'll see in methanol poisoning. First, take a look at this poor bootlegger here. Yep, he's passed out and clutching his stomach in pain. Looks like this homebrew was definitely a strong one. This passed out man is here to help you remember central nervous system depression, and the vomit is here to help you remember, well, vomiting. Methanol poisoning commonly presents as CNS depression and vomiting, which you can just remember as our guy getting a little too drunk here. Next, notice how this bootlegger has fallen into the middle of a ravine, or a deep, narrow gap in the middle of the earth. The gap, or ravine, is here to help you remember that methanol poisoning can cause anion gap metabolic acidosis. Get it? A gap for anion gap? Methanol is metabolized to eventually form formic acid, causing an anion gap metabolic acidosis. Our bootlegger has physically fallen inside this gap, which should help you peg this fact. Let's take a step back to talk about what an anion gap actually is and why it happens. You see, when blood tests detect acidosis, determining whether an anion gap is present can help you make a diagnosis. Electrolytes in the body are positively charged cations or negatively charged anions. Commonly measured cations include sodium and potassium, and commonly measured anions are chloride and bicarbonate. For electrochemical balance, the number of anions roughly equals the number of cations. But sometimes, in acidosis, the number of anions appears to be less than the number of cations. In other words, there is an apparent anion gap. This is not because we're out of electrochemical balance, but rather because not all serum ions are routinely measured. In methanol poisoning, the unmeasured anion is formate, which is formed by formic acid. Therefore, in patients with methanol poisoning, acidosis is present with an anion gap, which is caused by formic acid. Just picture a gap here to peg these facts. Next, notice this other bootlegger wearing a blindfold. Seems like he's doing some sort of blind taste test here. Is the home brew better than store-bought beer? Let's find out. But first, can you guess what this blindfold might mean? You got it. It's here to symbolize blindness. It turns out that the methanol metabolite formic acid is toxic, and as such, methanol poisoning can lead to optic nerve destruction and subsequent blindness. It's pretty hard to see anything with a damaged optic nerve, right? So how do you treat these effects of drinking wood alcohol? Well, take a look at the foaming head of the store-bought beer here. Yep, this foam should help you remember fomepizole, which is used to treat methanol poisoning. Get it? Foam for fomepizole? Recall from biochemistry that fomepizole competitively inhibits alcohol dehydrogenase, which normally converts ethanol to acetaldehyde. When methanol is ingested, however, alcohol dehydrogenase converts methanol to formaldehyde, which is later converted into formic acid. Remember, this formic acid is the toxic intermediate thought to cause blindness and the anion gap acidosis. We can prevent the formation of formic acid by administering fomepizole, which inhibits alcohol dehydrogenase. Less formaldehyde, less formic acid. And less formic acid means less toxic effects. Makes sense, right? Now, not all of us have the luxury of being at hospitals with stocked drug shelves. Take a look at my bootlegger's beer can here. If you're stuck in the woods brewing alcohol and you don't have access to fomepizole, your next best treatment is to administer ethanol IV, symbolized by our beer here. Yep, you heard me right. Use ethanol, or just normal, regular alcohol, and inject it straight into the veins. This works because ethanol has the same mechanism of action as fomepizole. It competitively inhibits alcohol dehydrogenase, stopping methanol from being eventually converted to formic acid. And as you can see, this guy taking the ethanol is doing a lot better than his friend inside the ditch. Just remember this picture to remember ethanol can also be used to treat methanol poisoning. So here's what you need to know on methanol poisoning. Methanol can be found in wood alcohol or home-brewed alcohol. Methanol is converted to formaldehyde by alcohol dehydrogenase. Formaldehyde, in turn, is converted to formic acid, which is a toxic metabolite. In patients with methanol poisoning, the accumulation of methanol leads to an excess production of formic acid, which then leads to an anion gap metabolic acidosis. Accumulation of formic acid can cause central nervous system depression, vomiting, and abdominal pain, and optic nerve destruction leading to blindness. The treatment of choice for methanol poisoning is fomepizole, or ethanol. Well, that wraps up this segment on methanol poisoning. On to the next one.